Great. Thank you, Angie. And thank you all for joining us here today. We love to share information about the GI360. We feel that it is a very broad-based, very comprehensive approach to microbiome health, which, as you know, affects everyone and almost every diagnosis and condition. So let's dive into this presentation. Today, we are going to discuss an overview of the gut microbiome testing called the GI360 and its utility in practice. Also, we're going to talk about stool sample collection, the best way to do that. Certainly, we do have collection instructions on all of our kits, but we'll go over that quickly. We're going to talk about the rationale for incorporating the complementary methodologies. So all of the different ways we are looking at the microbiome are rolled into the GI360 for you. We'll talk about advantages and then limitations. Of course, no test is perfect. In terms of that, that's how we cross-reference and cross over. And then we're going to talk about the dysbiosis index, the diversity scores, the key bacteria that we know based on the peer-reviewed literature need to be found inside a normal biotic gut. So these are clinically significant bacteria. So we focus on that in the GI360, and we'll talk about that in a more of a clinical context with a case study that I've brought up for you. And then, of course, we're going to talk about the importance of follow-up testing. We make it very simple and affordable for you in the way we can do that with the GI360. You don't have to pursue the whole GI360. We can break that apart, and we'll talk about that. I usually start my consults by mentioning that we have a website dedicated to the test up at GI360.com. Lots of clinician resources up there, including this GI360 resource guide in the center. The website looks like the splash page over on the right. And then we also have all of our publications up there as well. We've got practitioner videos, lots of information in regard to the GI360. We have different profiles of GI360 as well. So we have variations on the theme of GI360. This graphic up there will tell you the 3 different types of GI360 and what they each contain. So in terms of retesting purposes, you can make this a little bit easier on yourself. So in regard to our publications, we've got 20 peer-reviewed literature articles up there for you to review. We've got 15 great videos from leading scientific authorities and clinical experts up there. We also have similar videos on our Doctor's Data website too. So you're covered in both areas, but the GI360 is just about the GI360 test. So what is the GI360? It is, as I said, sort of our capstone stool test, if you will. It involves complementary identification methodologies, which include PCR or DNA amplification, microscopy, and microbiology. We also have a normobiotic and dysbiotic microbiome index, and in a way for you to compare your patient's findings to what would be a normobiotic patient's findings. We also have state-of-the-art stool chemistry analysis. And then, of course, anything that is found as dysbiotic on our microbiology profile within the test, we offer you susceptibility testing, patient-specific agents and results of agents on these organisms, the dysbiotic bacteria and the dysbiotic yeast. So all of this results in, of course, these clinically actionable results that you can literally go from my consult into your patient's consult and have great answers for them in moving forward. In any gut microbiome testing, there would be obviously indications. So any patient that you encounter with chronic metabolic conditions like diabetes or metabolic syndrome, any immune dysfunctions, any chronic inflammatory diseases, mental health issues, and any longer-term low soluble fiber diets would be a great candidate for gut testing. Say, for instance, the standard American diet, the low FODMAP diet, the keto, the vegetarian, carnivore, etc. So these are all reasons for you to use stool testing for your patients because of the interaction between these diagnoses and the root cause of gut imbalance. Also, fertility, hormonal health patients, of course, are perfect candidates for gut testing in terms of all that goes on within the microbiome and the crossover into fertility. And of course, obesity patients who are now becoming more and more a population who use these GLP-1 drugs, and the influence of the microbiome on these GLP-1 receptors. Other diagnoses and symptoms for patients would be any sort of a known and enteropathic history, IBD, the IBS umbrella, any known yeast or parasites that they've had in the past, and of course, any symptoms related to gut bacterial dysbiosis, which those symptoms are varied. Also, any patient with the crossover of the central nervous system axis, the liver axis, the lung axis, the adrenal and thyroid axis, and the gut. All of these axes do play a role in combination with the microbiome health. And of course, once in a while, and probably more and more often, we're getting patients just looking for optimal health and longevity and checking in on their microbiome. Some contraindications for gut microbiome testing in terms of when and why and how you would use stool testing. The sample that is collected by the patient, certainly we give patient very specific instructions in the kits, but we try to keep the fecal sample away from any urine, water, or blood so that the results are not confounded, if at all possible. The use of some of these medications that are listed, the anticoagulants, aspirin, even eating rare meat, large dose iron or vitamin C, NSAIDs, gout meds, corticosteroids may cause some elevations in some of these markers that can be explained by that medication. We recommend being off as many medications and supplements as possible prior to collection. And we can talk about that if you need to on a one-to-one basis. We also would recommend not using the over-the-counter or any oily laxatives or suppositories, let's say. We do approve magnesium citrate, oral fleet, and psyllium husk for that constipated patient who does need to move a stool to be part of the collection, the 3 different collections that we ask for. And waiting for at least 4 weeks from any colonoscopy or barium enema at all, really, before collection would be ideal so that the microbiome can regrow and we can assess the natural growth. Okay, this gets into our collection instructions. We do recommend steering clear for 2 weeks of any antibiotic, antifungal, antiparasitic. All of these are obviously going to have an impact on the growth across the board on these organisms. NSAIDs 2 days before test. So NSAIDs, of course, laxatives, even charcoals, binders, betaine, HCl, antacids, all of that is listed here. The rest of the other information is everything we've already talked about. The methodologies that we use in terms of how this test is analyzed for you is we start the section with the beneficial microbiome using PCR. So I wanted to identify what PCR is and its role in terms of how it varies from culture when we are analyzing a stool. So PCR is a technique used for the amplification of specific DNA sequences. The results are limited to very specific probe sets used. Okay, so we are looking for very specific fish with a very specific hook, and that is the way we describe it. The probes are highly sensitive, 95%, and very specific, 99%. So that is the benefit of using PCR. We detect 8 pathogenic bacteria, 47 beneficial bacteria, 3 viruses known to live in the GI system, and 3 parasites. We follow up, though, with a full parasitology report, so those parasites are not limited to 3. Our PCR probes are FDA cleared and EU marked, which is a European designation. So that's PCR for the beneficials. We also use PCR for pathogens, so we'll go over that when we go over a sample test. The next methodology we use is culturomics for bacteria and yeast. So microbiology culture is generally considered the gold standard and defined as 100% sensitive. If it's there, it's there. If it's not, it's not. We use the Maldetoff library, which is a vast library of over 4,000 genera and species of bacteria and fungi and yeast, which is huge. It's multiplied geometrically in the last several years. It calls the genus and species correctly for that bacteria, fungi, yeast very quickly. So we are very grateful, and the specificity of this is 100%. So it allows us to really quicken the pace of our identification. A lot of our species of yeast, as you can see, maybe a little bit less than half are Candida species, which is very interesting. It's a very common species in the stool that we see. These isolated organisms do allow for direct antimicrobial susceptibility testing. So what that means is we put patient stool in vitro with both natural and pharmaceutical agents. And we're going to talk about that later on in this presentation. But the PCR does not allow us to do that. So this is not a wall chart. It's not a cookbook. It's not out of a book. It is really unique to that patient. How does that patient's stool and the organism in the stool, what is the efficacy with both the natural and the pharmaceutical agents? So it's very specific and very direct. Culture also allows for the benefit of identifying unique species like the Archobacter species or the Larybacter hongkongensis, which was identified in the DDI laboratory. So this is a sample report that we're going to run through. I'm just going to touch on this first page. This is the summary sheet, I like to call it, of the entire test. So this section, this is going to be below your information, the patient's information on the test, this first page. 3 out of the 4 of these sections that are listed here all refer to the beneficial microbiome. So the hexagon shape, the dysbiosis index score, the diversity score, and the GI health markers. They're all in reference to just the beneficial microbiome. And then there is a key findings section at the bottom. So let's go through those. The hexagon shape, 6 sides, represent the 6 different phyla of beneficial bacteria that are known to be found inside a normal biotic gut based on the peer-reviewed literature. So these are clinically significant species that should be living in the large intestine, basically. There are many species in amongst these 6 different keystone phyla that we will run through in greater detail here in the next few pages of the test. But ideally, the patient's results is that white film overlaid on top of the hexagon. So ideally, you'd want that white film to touch somewhere inside the green shading, green being normal biotic on this hexagon. There is a yellow area that is outside of the green on the top and bottom. That is 1 standard deviation away from normal, high or low. The red band around the edge is 2 or 3 standards too high. And then there is blue in the center, if you can see that. That would be 2 or 3 standards too low of a finding. So this is all sort of giving you guidance from an aerial view. I'll call it, the from the bleachers, if you will, of how the patient compares to a normal biotic gut. So as you can see, there are some phyla that are lower than the green, some that are outside of the green, et cetera. So what does all that mean? Well, we put all of the individual membership that are contained inside these 6 different phyla into an algorithmic equation and outshoots this dysbiosis index score. This is, some of the members are weighted a little bit differently, but it identifies your patient against what should be normal biotic. In this case, at a 5, this patient is highly dysbiotic, imbalanced. So the beneficial microbiome is imbalanced. We would like it to be at a 1 or a 2 in the green. The diversity score is based on Shannon's index, which is an ecological score. It measures the lushness of that terrain and the reproducibility rate of those bacteria. And in this case, it's a 3. Again, we'd like it higher at a 4 or a 5. So we want low dysbiosis, we want high diversity. So I think we've gone over the dysbiosis and diversity indices as algorithmic measurements. A dysbiotic gut, think of it as an imbalance. The beneficials are imbalanced. There is a need to bring balance back. It has nothing to do with anything else that we found in this test. Imbalance may be associated with diet, age, older folks, younger folks, medication, antibiotic use, of course, hygiene and environment, Any inflammatory conditions could influence the microbiome growth, along with any other previous diagnoses. And then, of course, stress, chronic stress as a sympathetic dominance issue with the microbiome is huge. The dysbiosis and diversity score is unique to the GI360. The scores are based on over 5,000 subjects. So just be aware that these are very heavily researched and validated. And we use a population with the IBS population and the IBD population to determine comparing them and what is healthy. So we've gone through the hexagon, we've gone through the scores. Let's go through these GI health markers at the bottom left corner. These are functional guilds within the microbiome. They are groups of bacteria that perform the same role in the ecosystem of the microbiome, even if they are taxonomically distinct. So they may not be all within the same phylum. The butyrate-producing bacteria, the gut barrier protective bacteria, intestinal health markers. We have a listing of all of those different members on our website, but here it is. There are handfuls that sort of dictate and describe the functions of those guilds based on the literature, of course. So we give you that as guidance, as a touch point for you and the future of your patient to say, we need to work on butyrogenic species, we need to work on the pro-inflammatory species, et cetera. It's sort of a list of things to do. And then finally, on the first page, the bottom lower right area, key findings would be everything else that we found on the test that was out of range. So for instance, in this finding, we did detect on PCR, we detected the C. diff toxin AB, obviously lysozyme, secretory IgA, et cetera, et cetera. The cultures will be over to the right. Anything else that we found in the test is listed here for you. So I won't belabor going through detail by detail, but I do have some examples here coming up. But these are the next 3 pages of the test are the findings from the membership, the beneficial membership listed phylum by phylum, sorry, 47 different members of the 6 keystone bacteria. I decided to pull out sort of what you might see with the standard American diet, the SAD microbiome. That's what we usually see. They're out there, they're coming through. And so that is our most common, but we definitely see patients who, of course, are on other diets that are indeed low fiber, low soluble fiber. And that's really the common denominator here, apart, of course, from the lack of other benefits in a good diet. The poor soluble fiber is usually the common denominator with low FODMAP, carnivore, ketogenic, et cetera. So with those types of diets with the low soluble fiber, we're often going to see a whole entire actinobacteria phylum, which is the very first phylum, the actinobacteria, the actinomycetales, and the bifido family, bifidobacterium. Usually and often, 1, 2, or all 3 of those are low. So those are sort of suffering due to the diet. The bifidobacterium is, of course, a cornerstone species found in many probiotics, responsible for the manufacture and absorption of our B vitamins and K vitamins within the large intestine, the exogenous ones. It, of course, creates short-chain fatty acids like acetate. And does prefer polyphenols, which also can help. The bifido can also help ameliorate inflammation in the gut. The Bacteroidetes phylum is next. Some of the species here are also affected with a diet that is imbalanced. I won't belabor that, but I will say that the Bacteroidetes phylum is susceptible to elevations when the diet is more imbalanced in fat or protein. So keep that in mind for those special diets or the SAD diets. You might see that many of these members are elevated. It doesn't mean that we go after these members, by the way. These are all beneficials. We're not eradicating in the next 2.5 pages. We are simply bringing balance back by adding probiotic and soluble fiber to fill up the enterocyte and feed the environment with that fiber. So it's a seed and feed approach as opposed to eradication. So just be aware, even if it's in the red. The Firmicutes phylum is the next page on the test. It houses many of the key butyrogenic species, so butyrate-producing bacteria. Butyrate being very important. We'll talk about that next. But usually we'll see a low Clostridium methylpentosum. We'll see a low A. halley or E. halley used to be, a low Faecalibacterium. So all of these lows, they're suffering due to poor soluble fiber and not enough presence of the cornerstone species like the Bifido and the Lactobacillus. We have a normal finding of Lactobacillus on this particular sample, which is about 2/3 of the way down the page. We've got an elevated Phascolarctobacterium right below that Lactobacillus. That is a bacterium that produces short-chain fatty acids, can be associated with metabolic effects and the mental state of the host. For instance, in the literature, can correlate with anxiety, depression, et cetera, mood disorders, et cetera. We sometimes will see an elevated Mediterranobacter navis, which is a mucin building when it's normal, but when elevated, it is a mucin degrading specialist. So it's degrading the mucin. The mucin is part of that build of the mucosal barrier. So it's not at all a leaky gut test, but it is an indicator that these members, we rely on these members for a lot of our GI function, including a good, strong mucosa. Just to touch on this Faecalibacterium prausnitzii, this major producer of butyrate, nourishes the enterocytes, regulates inflammation, immune processes, the mucosal barrier integrity, and it does suffer with a low FODMAP or low fiber diet. Other benefits for this member are here, so it's just something that I like to touch on and make sure if the patient thinks they're taking in enough fiber. I would, if this is low, I would argue that they might not be taking in enough fiber. So I would always go to the recommended dosing of the water-soluble fiber, which is not the vegetable fibers. And that would be 8 grams to 15 grams a day. The vegetable fibers would be, of course, the insoluble fiber. Speaking of fiber, quickly, this is our recommendation based on the literature for the health of the microbiome for soluble fiber. The FDA recommends 22 grams to 35 grams total fiber. That's soluble and insoluble. But the soluble fiber is really what we focus in on, therapeutic dosing of that. It helps to feed all of these species, very reliant on that. A more constipated patient can really benefit from enough soluble fiber that are feeding these species. You can find it in food form here with these listings like beans and chickpeas and artichoke, but you can also find it in supplement form. Inulin, chicory root, psyllium husk would be the top 3 in my mind, and then apopectin would probably be 4th. So keep that in mind with patients across the board, even when they're not on a probiotic. This is for the health of the microbiome. Well, let's move on to additional effects of, say, a poor diet. We would usually see impact on the Veillonella species. This is a major short-chain fatty acid producer that usually will start to drop low. We might see elevations in this Proteobacteria phylum, with which, just like the previous page, the Bacteroidetes phylum, it elevates in the presence of a diet that may be more heavily weighted in fat or protein, sort of more considered a pro-inflammatory. So sort of flourish in the presence of existing inflammation. And again, we are just bringing balance back. And for this particular patient, with that Bifidobacterium, and you can use a little bit of Lactobacillus and enough soluble fiber. The very last member, this Akkermansia mucinophylla, more and more topic of discussion and research, is defined as a mucosal builder. It helps support, it's a second member that supports the mucosa. It also has crosstalk with the immune function. So the immune system is important with this member, as well as the GLP-1 receptors. So we make sure this one is well fed. It is more prevalent, so it might elevate after weight reduction, which is an interesting phenomenon with this one. It is decreased with patients with diabetes, obesity, inflammatory bowel. It does benefit from dietary and supplemental polyphenols. So what are polyphenols? Any of the brightly colored foods, the berries, the green tea, the chocolate, probably stick with cranberries, pomegranate, curcumin. But polyphenols can be found in the diet, and a daily dose of that is never a bad idea to support this member, along with the bifido, as we already had mentioned. The recommended, there is no official recommended daily intake, but 1 to 2 grams per day is associated with chronic disease prevention of polyphenols. So lots of good information on polyphenols in the literature. So that ends the beneficial microbiome, the tour of the beneficial microbiome. Next in the test comes the GI pathogens report. This is PCR detection of these pathogenic viruses, bacteria, parasites. Next is parasitology. Of course, we have a full-blown parasitology report here, but we're not limited to these species. We have many more that we can identify. We have full-time parasitologists on staff at Dr. Stata. We have other markers also on the parasitology report. So while we're under the microscope, we report out on these other artifacts. This is a yeast finding that we'll talk about later. In this case, it was not positive, but we'll talk about it in a minute. It's a dead microscopic yeast. And then next will be red blood cells, white blood cells. Red blood cells could be positive if there is a history of hemorrhoid, maybe an unknown history of hemorrhoid. White blood cells will be more of an indicator of inflammation. Muscle fibers, of course, vegetable fibers, sarcolytin crystals usually associated with parasites, and then pollen, which doesn't happen often, but just indicates that your patient is challenged, your immune system is challenged with some sort of a pollen intake. Next section is going to be our microbiology cultures. Again, these are 100% specific and sensitive. So we are looking for whatever shows up on the Petri dish within the microbiology cultures. We are specifically looking, though, for pathogenic bacteria. So this is a different approach. We are making sure to double check our work from the PCR finding that there is nothing actually living and colonizing on culture. So that is a good cross check. That's why we do it for you. The imbalanced bacteria list is a list of commensals, so better known as commensal bacteria. There is a purpose for these in the microbiome. They are not categorized as beneficials, but there is no need to treat these. The only treatment would be if, say, they were overgrown, like this particular list is a little bit longer than we would expect and would want. They are taking up valuable real estate, so we would want improvement in the microbiome with probiotic and soluble fiber to sort of crowd out these species. There are a handful of commensal bacteria that do, at higher levels, fall into a dysbiotic bacteria category. Not all do, but some do. And we have 2 here listed as at a dysbiotic level, starting at a 3+. And then in this case, no yeast was isolated. So the cultures allow us to give you that very valuable sensitivity testing that I've already talked about, how to treat the organism in that patient's stool. And we'll talk about that later on, but culture allows for that. And then the final page of markers is the stool chemistries. We cover digestion absorption markers like elastase, which is a pancreatic sufficiency or insufficiency marker, which depends on where it lands. Fat being malabsorbed, carbohydrates, those are not a normal finding in a stool to be malabsorbed, but they are sort of a transient, sometimes transient phenomenon. Important inflammation markers that we cover, the lactoferrin, calprotectin, and lysozyme. And then we look at immunology, short-chain fatty acids, intestinal health markers. We're gonna run through these a little bit for you. Actually, let's go back. The secretory IgA marker is an immune response. How is the immune system responding to something in the GI tract? This should elevate appropriately high if there is an organism, say the Klebsiella that we found on the previous page that we cultured, or could elevate for an autoimmune condition, or could elevate for a food sensitivity. That ties into the inflammation markers as well, because the lactoferrin and calprotectin, while they are very specific to IBD patients, need to both be elevated out of range for us to be considering it an IBD situation. The lysozyme is non-specific to IBD, can elevate for, say, a bacteria that we found that was dysbiotic, a yeast, parasite, a virus, also a food sensitivity. something like diverticulitis or diverticulosis. So it is more site-specific in the gut versus lactoferrin calprotectin, very more global inflammation like the IBD patient. Next is a short-chain fatty acid panel. That's what I'd want to go to next. Short-chain fatty acids are produced through the fermentation of these non-digestible carbohydrates from the fibers that we give it. It very influenced by these dietary substrates, the fiber. The short-chain fatty acids modulate the immune system. They coordinate with autoimmunity containment, metabolism, and provide homeostasis. So very important for the short-chain fatty acids to be on board. They are made by the beneficial microbiome. So this panel ties into how well is the microbiome doing. And when you're investing in the microbiome with the probiotic and the soluble fiber and trying to maintain growth there, these short-chain fatty acids will, of course, benefit from that. But I will always look to see what the bottom line is with butyrate and total short chains to determine how well these substrates are being made. The short-chain fatty acids also communicate to other systemic physiology, as listed here. And if they're low, can be linked to various diseases, including the IBD patient and other disorders. All right. Beta-glucuronidase is another marker that we have on the stool chemistries page in the GI360. The microbiome creates beta-glucuronidase. It's an enzyme that breaks that tight bond between glucuronic acid and toxins in the intestines. So important to know for your patient where that marker is. A high level of that beta-glucuronidase activity in the gut is not desirable. Could impact the reabsorption of phase 2 deconjugated elements. It might imply that the patient is being exposed to more toxins or may have trouble breaking down estrogens. And we don't know. It's a screening, so just be aware that further testing would be warranted if there was a high beta-glucuronidase. Also, high beta-glucuronidase could be attributed to a high-fat diet, high-protein diet. The low-fiber diets are also involved with that higher BG activity. A low level of beta-glucuronidase is at this point not known to be of any direct clinical consequence, may be a result of a beneficial microbiome that might be insufficient, and sometimes is tied in the literature to a vegetarian diet as well. Okay, so we've gotten through all the markers. Next, in the test, we would then provide you with, if applicable, if we found anything, we would provide you with susceptibility testing and sensitivity testing for the organism found. So this is not the this is the culture page, but it is going to refer to down at the bottom here this Klebsiella. The 2 Klebsiellas would be eligible for sensitivity testing. Anything above a 2+, so at a 3+ and a 4+, you will get sensitivity testing for bacteria. At a 2+, you will get sensitivity testing for yeast. Anything that we found from a pathogen standpoint would always be standard of care. We will still mention that in the report for you. Say if we found C. diff, if it needs to be treated, or salmonella. Well, oftentimes, though, many of those pathogens, it is contraindicated to treat. It's just sort of a support the immune system, support hydration therapy, but certainly that's a clinical decision up to the practitioner. So this is what the sensitivity testing does look like, and it is identifying our natural agents, the list there, and how each of those agents did in vitro with the patient's stool against, or with this Klebsiella against these agents. So we would want, for the natural agents, we'd want you to suggest 2 agents concurrently for your patient. The most highly sensitive would be the most logical. So in this case, caprylic and colloidal, silver. And of course, then we also have prescription agents that you can choose from as well. And it's good to know if the patient is resistant or susceptible to these. So this is a big benefit. So again, as a reminder, just for the natural agents, we would choose 2 of the highly sensitive agents. Dose and duration is always going to be up to the practitioner. You can always refer to your supplement company or the literature. We are in vitro, we are a lab, and we are very proud of what we do, but we try not to get into treatment for the patient with the practitioner. We also don't mention brands. It's just too hard to keep up these days with how things are changing. So we recommend that you use a clinical grade, of course, product, whatever it is. And then for the prescriptive agents, we would just choose one agent, and it's just standard of care. All right. I wanted to bring up this dead microscopic yeast because this is found under parasitology. On the sample that we went through, it was negative, but sometimes it is positive. So in this case, of course, it's coming up as many. This is dead microscopic yeast. So what does that mean? It may mean that there is dead yeast found in the stool due to a dietary intake of, say, beer, wine, kombucha, yeasty breads, nutritional yeast flakes. Those are usually the usual suspects. It may also be die-off as a result of a cultured yeast. So that would be in reference to, say, a cultured yeast on the microbiology. Both of those could apply. The third possibility, and we can't prove it to you, but the third possibility would be something called small intestine fungal overgrowth. This is a fungal overgrowth living in the small intestine, somewhere higher up than the large intestine, because we specialize in the large intestine. If it wasn't cultured there, it may be living elsewhere, dying off in transit, but producing symptoms like upper GI gas, pain, bloating, GERD, nausea. All of those, any and all of those skin conditions could all be related to a yeast overgrowth. We want you to know that that is a differential, and we leave it up to you to decide to treat that. If you do treat, we would either have you choose your favorite anti-candida protocol or antifungal, or we also have on our website under materials and resources, we do have the antibiogram information for both bacteria and yeast, all the species that we commonly encounter, all the natural agents, the efficacy percentages, et cetera. So you can almost use that as your treatment guide if you feel it's appropriate. The rest of the test then, after the sensitivity, if that is provided, is going to be commentary. We're going to give you details on anything we found that was out of range, everything from the microbiome all the way down to the stool chemistries markers. So in the case of the sample that I brought up for that standard American diet, we would be addressing the dysbiosis and retesting. We'd be addressing the diet, of course. We'd be supporting, after your treatment, we'd be supporting with a rebuild of the beneficials with fiber, probiotics, and stress reduction, of course. That's always an impact. And then, looking into the potential of rebuilding that gastrointestinal mucosal barrier with some of these strategies here. Our retesting profiles, I promised to go over those in our objectives. We try to break it out and make it easier for you to retest and more economical. We have plenty of profiles to choose from, everything from just the GI360 microbiome. So the first 3.5 pages of this test can be its own test, and that's one of the options up at the GI360 site that you can look through. And then there's the GI360 Essentials. It's basically the whole test except the stool chemistries. So if you don't need stool chemistries, you can get the cultures and the parasitology and the PCR findings. You can just get the GI pathogens profile. You can just get parasitology. So we can break things down as small or as large as you need, including the stool chemistries. We have separate markers there that are available, like elastase, if you want to recheck just that, or the inflammation markers, et cetera, beta-glucuronidase, et cetera. All right, I think I am done with my content. I'm happy to answer all questions.